Amanda Jaska is a bereavement counselor, and you're with the Gilchrist Counseling Support.
Yes.
So important. I think there's a generation, and maybe even all generations, there are people who think, I can do this myself, I don't need to reach out for any help, I can, just buck up and I'll just continue on and all that. But we can be so much more, and we can heal and grow. And anyway, so let's just start with talking about how we find you after a death.
Well, over at Gilchrist, as part of our program, we provide 13 months of bereavement support to our family members. So following a death, following a loss, and even beforehand when we talk about caregivers, we're available to be of a support to any of our family members who are looking for someone else to speak with, to meet with. But we're also here in the community as a support as well. So you don't necessarily have to have had a loved one die with Gilchrist on our hospice program in order to receive support from bereavement, from our grief services.
So you're talking with caregivers even who are dealing with end-of-life issues. They're not even there yet, but they're starting probably to have anxiety about it and worry about it?
Yes, what we refer to as anticipatory grief. So upon learning that their loved ones have a terminal diagnosis or upon the decline, we will see a lot of people at times start to struggle with that, as we would predict. When you see your life change because someone else's life is changing, and how many times do we refer to different decisions as it's not a matter of life and death. Well, when you look at hospice, when you look at end of life, it is a matter of life and death, and that's a lot of pressure to put on someone who is in charge of making sure that the end of someone they love's life is the best quality that it can be.
And if that person is in charge, I would imagine they too they're spent kind of in many ways, physically, emotionally, and then grief takes on a different sort of form. And do you help them balance their lives? It sounds like more than just bereavement.
Absolutely.
That you do. Yeah.
Because the thing to keep in mind is, when you look at loss, there's grief involved. Looking at who you were while this loved one was healthy, looking at your life as just someone out in the everyday world, and then all of a sudden this diagnosis comes and how that changes you. And okay, we have to change, we have to react. The life I knew isn't the same, even though this person is still alive. And then as time goes on, the illness changes. I had a client I worked with once who said, it's just when we thought we had this was her husband who was ill, just when we thought we had all of his pain managed and I thought I had everything lined up, all of a sudden it switches. And then it's like starting all over again. We have to find the medication that works and that's going to make him comfortable. And each time there would be a change, she would have to change because he changed. And so there's a grief that comes along with that. The things that you would typically be able to do for fun, for self-care, all of a sudden you're not able to do anymore, or have to find different ways to have those needs met. So, there is a lot of, like you said, balance involved.
What are some of the, I imagine there's anger, guilt, maybe even at being the one who's surviving. What are some of the other sort of emotions that people, they're all over, right?
Absolutely. Well, we're human beings, and as humans, we experience a multitude of different reactions, different responses. So a lot of times when I work with clients who will speak about the anger, for instance, is looking at the fact that, okay, you're not angry at the person. Sometimes there's that anger. That's always a possibility. But it's the disease. It's the fact that something is happening beyond your control, and here you are forced to deal with it. So the anger, the frustration that comes along with that. You mentioned guilt. And looking at just what that word is. Where is that guilt coming from? Is it even guilt? As human beings, again, we always think that we can do everything. We can't.
Think we're in control.
Absolutely. And a lot of times the responses that we have come out as a result of that lack of control, as the lack of, something happening that we can't fix. When your loved one's dying, you don't have a redo. You can't go back and you can't change things. But There's sadness that can come. There's, relief that can even come, bringing a hospice team in, having extra hands, having extra people there to be able to support your loved ones so it's not all on you. Oh, what a relief that is to be able to be a daughter and not a caregiver.
When else, except when you're a caregiver, helping a loved one who is in the end stages of life, you probably at some point feel there's no reward to that hard work, right? So you have to almost rethink, there's almost a paradigm shift that has to happen in your mind. What is the goal? And the goal is comfort, providing comfort, because the end is the end.
Yes.
And some people have a hard time even dealing with that.
There's a lot of times I've met with clients who will say, well, I'm relieved. Everything, they had a peaceful death. It was, quote unquote, perfect. If I could have planned it out, we had all these people who were here to support, my family was here. But then there's the flip of, but does that mean I'm happy that they're not here anymore? Does that mean I'm glad that they're not here? And then the guilt pops in, then there's that type of response that comes afterwards. And it's not, it's just your body trying to.
But grief is a roller coaster.
Absolutely.
And you're only with your people, your clients, for a certain amount of time. But we all, I think we can put a time frame on grief. And they may need somebody longer. So when you leave, what happens?
So at Gilchrist, we have a wide variety of groups of different events that we do throughout the year to help celebrate, to honor loved ones, but also provide that community of support. So, when you talk about a lot of times caregivers feeling as though they're isolated in what they're going through, we see that with bereaved as well. Is what I'm doing normal? We hear that question a lot about being normal and right, and it is what it is. As much of a cop-out that seems sometimes. But being able to recognize that, okay, there is a group. There are a lot of people out there that perhaps we can get together in a meeting of, maybe 6 weeks, or a big celebration event that we do. We have a couple of those that go on throughout the year. But a lot of times as well, we can't fix everything. Like you said, with grief, there's no timetable. I always tell my clients, you either deal with it now or you deal with it in the future. It's going to come at some point. But if it comes at some point down the line, if we're not able to be that provider, if there's things that come up that are too complicated for what we can do in such a short amount of time, then we do have referrals for individuals out in the community who can continue to support them.
What do you think people who are grieving really want?
What do they really? Well, they want their loved one back. That's what they want most of all.
Do they want to be just heard? So when grief can sometimes bring people to you, and it can repel people because people don't know how to talk about it, and every case is individual. But do they want to just be listened to? Do they want to be not avoided? What are some of the biggest complaints about someone who's dealing with grief still trying to get on with their lives?
And with that question, it's tricky because it could go either way. That there's some people who all they want to do is talk about their loved one and be heard. But with other people, it's I just want to go to work. I want to have some time where I don't have to think about it all the time. So wanting that break, wanting things to be, again, normal. But as one of my clients said to me, it's like, I'm tired of hearing the new normal out there. Everybody talks about the new normal. She said, this is my new reality, and having to adjust to what the new reality is. And it might be some days wanting to talk, and it might be other days just wanting to just pretend things are the way that they were before.
So there's no one way, and that's okay.
Absolutely.
You have a list here of tips for caregivers. Is anyone taking care of anyone right now, or have in the past? Yeah, it's hard. I'm sort of taking care of my mother, but we're not quite full on yet. But so these are just. Can we go down this list?
Absolutely.
I don't even know if you have it handy.
Sure.
But so first of all, it's just sort of talking, having conversations. So my mother doesn't want to have this conversation. Here's the most she'll say to me: "Don't put me in a home."
Oh.
Is that like the?
That's the standard.
That's the standard, right? Don't put me in a home. I'm like, well, let's talk about what your options may be.
Sure.
She doesn't want to go there. So then what do you do?
Well, I think number one is that communication.
Okay.
It's the communication
Keep at
piece.
it.
So, having the conversations about what their wishes are and being able to respect their wishes. Now, of course, like you said, sometimes it's not always feasible. If you want to look at what is keeping them safe, so that they're not being harmed. Okay, well, if it's not safe for you to be in your home, then we need to figure that out. But if it's one of the questions along the lines of what you were talking about with advanced directives, they're specifically telling you what their wishes are, and that in a way makes it easy for you as a caregiver.
I was going to say that might be an easier conversation to have in the beginning. Making a plan would be all part of that. What if? In this case, what if we do this? Sort of like thinking through the different scenarios. We all think I think at a certain point in life, I know that and my brothers will guess how this is going to go down. But we could be way off base. Anything can happen.
Absolutely.
And so, sort of kind of thinking about different, what setting boundaries, without guilt, I should say. What does that mean?
Well, setting boundaries, again, I think earlier on they spoke about, the putting your oxygen mask on before putting others on. You can't, as a human, as a person, you need to be able to say, you know what, these are the limits that I have. I can only do so much, but I need help. And I think that's another difficult piece of caregiving is when you're giving, who's giving back to you? So being able to say, you know what, I need help, which is always difficult to ask for or to say, and setting those boundaries.
Which leads us right to creating a team for support.
Yes.
And also eating healthy, exercise, and get good sleep. I mean, people always say that. Take care of yourself. Hire help if possible. And this is what we've been talking about a lot is community resources. And if you reach out, it's amazing what's available.
Yes.
What a few phone calls will do, a few emails.
Yes, and I brought, even here, there's a good book, When Illness Always Turns Families on Call into Caregivers. And even from the AARP, there's a lot of different resources out in the community. We have the wonderful thing called the internet now where you can just type into Google, even for caregiver resources for support. We're on Facebook right now. Sometimes I've had clients who have really found support through a Facebook online group. You just need to make sure you look at, okay, is this something that's helping me or is this something that's not?
And if it's not, get out and move on.
Exactly, yeah.
Amanda, thank you so much for joining us and for all the work you're doing. So important.
Thank you.
Really appreciate it. And thank you to everyone for being with us today on Greater Living and talking about elder care. And, hopefully we all get there and we do it well, at least as well as we can.